Greetings. My name is Dr. Deepak Moses Ravindran. I'm a periodontist and implantologist with more than 15 years of experience in this particular field. I'm currently an associate professor in 𝐁𝐸𝐴𝐺 Institute of Higher Education and Research, and I'm also a consultant periodontist in clinics in Chennai, Kanchipuram, Tirulur, and Hosur. Today, I'll be going to talk to you about the importance of dental health and how it affects the other parts of the body also. Before we move into that, it's important to understand the parts of the tooth. As you all know, the enamel or the white part of the tooth is the strongest part of the body and is present in the outer layer of the tooth. Within it, you have something called dentin, which is generally yellowish in color. Following that, you have the pulp, which gives the blood supply for the tooth. You have the gums that surround the tooth, and follow that, you have the roots which are inside the bone. So these are the parts of the tooth. Now, coming to a child's milk tooth, they are generally 20 teeth in number, which start erupting from 6 months, and they're followed by the time the child is about 12 years of age. So these teeth generally have gaps in between them that help the child to bite and chew. By the time of 12 years of age, these milk teeth fall out, and then you have the permanent teeth that start erupting inside the oral cavity. So as we all know, the adult has about 32 different teeth for biting and chewing: incisors, canines, premolars, and molars. These are the teeth. These adult teeth help us to bite and chew for the rest of our natural lives. So as a dentist, it becomes very important for us to maintain these teeth and improve its health for our human life. So one of the most common diseases that you have in the oral cavity is periodontal disease. There are two types of gum disease. One is the aggressive form of disease, which is seen in younger individuals. The other is the chronic form of disease, which are seen in older individuals. So this is generally formed because of years of plaque accumulation on the tooth surface, improper oral care, and without visiting your dentist regularly. So this causes gum disease, bone loss, and eventually the tooth starts to lose inside the oral cavity. The other common disease that you will see is nothing but dental caries. So dental caries start off like small blackish or brownish spots inside the tooth surface, and with time, if you do not take care of this, if you do not brush at night, generally they tend to cause a lot of pain, and you will end up having to go to your dentist. As you can see in this slide, dental caries progresses from the enamel into the dentin and then finally into the pulp, which can then cause severe pain for the patient. The other common problem that you will also see in younger individuals especially is something called as malocclusion. So this is when the teeth are malaligned, teeth have spaces between them, and these generally have a problem, is both an aesthetic problem as well as a functional problem for the patient. So if the child is brought to an orthodontist at the correct time, this is then used with the help of aligners or metal braces or removable braces. These problems can be easily corrected at a very early stage, which then helps prevent gum disease as well as dental caries. The most common method that is generally used to maintain oral hygiene is the toothbrush. Now, the market has different types of toothbrush, different colors, different shades that are available in a supermarket. However, it is up to you after consulting with your dentist to choose the right type of toothbrush for your particular use. Okay, so generally we advise patients to use a brush with soft bristles and to change the brush every 3 months. There are various types of bristles also available in the market, medium and hard. Depending upon your dentist's advice, you can then go ahead and change and use the other type of toothpaste. But generally for daily use, we generally advise the use of soft bristled toothbrush. The other options that are also available in the market are the powered toothbrushes. So these powered toothbrushes have an oscillating motion wherein they go ahead and clean different parts of the oral cavity. So this is very useful for young children, adolescents, patients who have any physical or mental disabilities, or for any caregivers who are taking care of the patient. These brushes are generally a little more expensive than the natural filament brushes, but they're as effective as the normal toothbrush. The other question that we generally get asked very commonly is about the type of toothpaste that a patient should be using. Now, as far as toothpaste are considered, we generally advise patients to use a normal fluoridated toothpaste. Again, in the market, there are various types of toothpaste that are available. Please do consult your dentist for the type of toothpaste that is apt for you. Okay, so generally for daily use, please use a fluoridated toothpaste. The size of a pea is generally more than enough to cover and clean the whole oral cavity. Apart from this, the other common problem that patients generally face is that food gets stuck in between the teeth. This becomes a general problem. The patients generally start using a toothpick or a pin to remove the deposits from between the teeth. So dentists generally don't advise the use of these objects because these tend to cause more damage. So instead of that, there are various interdental aids that are available that a patient can be used. Again, this depends on your dentist, and after examining you, he will give you these interdental aids. So the most common ones, as you can see in this slide that I projected over here, is the dental floss. This is a small device which has a little bit of thread that is attached to it. This can be carried around anywhere, and you can insert this in spaces between your teeth to remove the deposits into that particular area. Okay. The other option is an interdental brush. Again, a very simple device which can be used to clean the gaps between the teeth and therefore remove the deposits that are present in that particular area. Okay, so again, please see your dentist. If your dentist recommend this, you can please carry it along to help remove the deposits that are present in between your teeth. The other common device or recent device that is available in the market nowadays is something called as this water floss. So this water floss is nothing but again an electronic device that squirts out water. So this squirting out of water helps in a very passive way to remove deposits that is present in between the teeth. Okay, so this is available in different types, as you can see in the picture over here. So different types of devices are available. They can be handheld or they can be connected to an electronic socket. All you have to do is fill it with water, and the water will then automatically spray out and clean the deposits that are present between your teeth. Okay, this is also an easy device. This is easily available on various online portals also, so you can purchase it sitting at home. The other common question that most patients ask us is generally the use of a mouthwash. Can I use a mouthwash? I'm already using this particular mouthwash. How long should I use a particular mouthwash? So most supermarkets will generally have basic mouthwashes like Listerine or Colgate Plaques. These mouthwashes you can use for daily use. However, if you have gum disease or a periodontal disease, at that particular point of time, your doctor will give a prescription mouth rinse, which is chlorhexidine. So this mouth rinse has to be used for a specific period of time and should be stopped after that. The mouthwashes that are available in a supermarket, you can use it continuously. Again, if you have a doubt, please do contact your dentist as to what type of mouthwash is apt for you. Now coming to the brushing technique, this is a common mistake that most patients do. They might have the best brush, they might use the best paste, but if you do not brush correctly for the correct amount of time, there is no point, as you'll be removing a lot of deposits. You'll not be removing any deposits from your tooth surface. So again, I put a slide for you to see and understand how it is to go ahead and maintain or brush your teeth. Okay, so there are a few steps that you should take. The first thing, when you get up in the morning, please see that you wash your brush. Once your brush is washed, take a pea-sized amount of a fluoridated toothpaste and keep it on the surface of your toothbrush bristles. Engage the brush at 45 degrees so that the bristles go inside the gums. Now, it's very important to clean from inside the gums because that is where you will have maximum amount of periodontal pathogens or gum disease causing pathogens present. Okay. Engage it from the gingiva or from the gums and move in a up and down motion. Okay. Most common mistake that patients do is to brush in a horizontal motion. So you will have a tendency that the teeth are a lot cleaner, but you will actually be causing more amount of damage for your gums as well as teeth. So it's very important to move in a vertical stroke from the gum margin to the lower surface of the tooth. And the other mistake that most patients do is that they tend to brush only on the outer surface of the teeth. Please insert your brush at a vertical degree so that it goes inside and cleans the deposit on the inner surface of the tooth also. Brushing should also be done on the biting surface on both sides, both the upper and the lower teeth. This will help remove deposits that are stuck in the gaps between the tooth surface. This will help you give a great and wonderful smile. Sometimes out of over anxiety or trying to take care of their health too much, we have patients who come with a lot of depressions and notches on the surface of the tooth, like you will see in this particular slide. So overzealous brushing, horizontal brushing, or brushing with the use of a hard toothbrush can also cause damage on this particular surface. So if you notice some spots like this on your surface of your teeth, please go to your dentist and get it rectified quite soon. Okay. The other question is, how often should I change my toothbrush? the general average time for you to change your toothbrush is about every 3 months. However, if you notice that your bristles tend to get frayed a lot quicker, they tend to get worn out a little fray, you can again consult with your dentist, maybe rectify the way that you are brushing and try to reduce and change the brush at a very earlier time. Okay, so the average time is 3 months, but depending on how it is frayed, you can then go ahead and change your toothbrush. Remember, after brushing, please do wash your brush inside with the tap water, running tap water, and always store it in an upright position. So this helps the water drain from the surface of the toothbrush so that there is no bacteria that is stuck onto the surface of your toothbrush. Thank you for listening. See you soon.